Good morning, everyone. My name is Hiroko today. Today I'll talk about this theme, malaria control in Africa. By the way, what do you do when you get sick? I think most people answer go to hospital and see doctor and get good treatment and medicine. In recent years, many diseases can cure by the development of the medical technique. However, in Africa, there are a lot of curable disease is killed a lot of people. Look at this figure. This graph shows the Nigerian total deaths by cause. There are a lot of curable disease ranking a high place in this ranking. Malaria is one of that. And almost African countries like such ranking. Then according to that, I consider the best way to reduce patients of malaria in Africa. First, I'll talk about malaria. Malaria is an infectious disease and it has a unique feature. It can cure by medicine. So yes, malaria is curable disease. There's a malaria feature of malaria. There are 3 points. First, malaria is transmitted by Anopheles groups mosquitoes. Look at this picture. This is one of Anopheles groups mosquitoes. It's the name of Anopheles gambier. So they have the parasites in their body, and when they bite us, we get the parasite and get malaria. Second, malaria is spread in high temperature and humidity place. Okay, then look at this picture. This is an African map. And so malaria spread in high temperature and humidity place. And this area, the Central Africa, is a match this condition. So this area is expand the high risk of malaria the whole year. They have high temperature and humidity for all years. And third, malaria makes various symptoms. The most famous symptom is fever. And another symptoms is like chills and vomiting and headache. So this disease, the incubation time is 7 days or more. And patients get severe fever for some hours at interval of few days. Malaria parasites, there are 4 kinds of malaria parasites. And these intervals is different from the kinds of parasite. So I said malaria is cured by medicine. So there's an example of the medicine for malaria. Quinine is the most famous medicine. And chloroquine and artemisinin is good effect for malaria. Then, malaria is transmitted by mosquitoes. So the prevention of mosquito is a very important thing to prevent malaria. So there is ABC method of malaria prevention. First, A means awareness, means understanding the risk of malaria. For example, we should know mosquitoes' behavior and malaria risk season and region, such as like the high temperature and humidity place. It means the malarial mosquitoes become active in such area. B means bad prevention. The most important factor to avoid malaria, we should protect our body from attack by mosquitoes. For example, using bed nets and clothes all doors and windows, and wearing long sleeves clothing, and using insecticide. They are very effective way to prevent the mosquitoes. I recommend using bed net and wearing the long sleeved clothing is the easiest way to prevention. And using insecticide is has some problem. Some insecticide harm for human, so I recommend to use safety insecticide like mosquito coil. And C means chemoprophylaxis. It means the preventive measure with chemical methods, like using the prophylactic drug and vaccine. Then, do you know Bartnolds? He is a teacher of agriculture university. He recommends very interesting way to prevent malaria. So let's look at the movie.
We have a unique smell. That mosquito larvae also have a very unique smell. And so we set up another crazy experiment because we collected the smell of these larvae, put it on pieces of cloth, and then did something very remarkable. Here we have a bar with 4 holes, and we put the smell of these larvae in the left hole. That was very great. And then you see the dog. It's called Tweet, it's a border collie. He's examining these holes, and now he's got it already. He's going back to check the control holes again, but he's coming back to the first one, and now he's looking into that smell. Which means that now we can use dogs with these inspectors to much better find the breeding sites of mosquitoes in the field and therefore have a much bigger impact on malaria. This lady is Ellen van der Zweep. She's one of the best dog trainers in the world, and she believes that we can do a lot more. Since we also know that people that carry malaria parasites smell different compared to people that are uninfected, she's convinced that we can train dogs to find people that carry the parasite. That means that in a population where malaria has gone down all the way and there's few people remaining with parasites, that the dogs can find these people. We can treat them with anti-malarial drugs and give a final blow to malaria. Man's best friend in the fight against malaria. My third story.
Okay. He says people who have malaria parasites have different smells from the not malarial people. So we can use trained dog to prevent malaria. I think it's very interesting, and so I think it is so effective way if we can do that. Third, I'll talk about present African. African people do not have habit to see a doctor when they get disease at first. Why they do that? I think it is 3 points of the reason. First, it's the shortage of clinic doctors and medicines. Second, the medical course is extensive for African residents. And last, many people regard as an important mental factor. So Africa has a large continent. However, there are short areas where we can get good treatment for good treatment and medicine. and it is so high cost for the people, for the African people, especially rural people. So it is the problem of the. So this is the problem of in Africa, present Africa, and they have original, unique tradition and culture. So, in that, according to that, they think the mental factor is important for getting better. So I think the reason is the lack of education and medical systems, bad medical systems. So people could not earn enough money and bring up doctors. So, and they depend on ODA and volunteer for medical system. So, the most essential way to spread the importance of modern medical care is to educate African doctors who know well about African tradition and culture. Because I think African doctors could provide a better treatment for people, because people than doctors from foreign countries, because they know well this tradition and culture. These are difficult to understand for foreign countries people. Then, what is the best way? So improving the medical system and education is the most important way to change current situation. First, set a substantial insurance and make more hospital and clinic is necessary for changing the medical system in Africa. There are health insurance in Africa, however, there are lots of people could not provide the insurance. And make more school and make more chance to study all people is more important for African future. So study all people, of course for children and for adults. Through this method, it is also important that independent from support by other countries is an important point to prevent malaria. So, then conclusion. There are 3 points of my conclusion. To get better such situation, the most effective way is make more chance of learning, of course for children, and for adults, all people. So better to say, a short-term solution is spreading using bed nets and safety insecticide like mosquito coil. This is our best way to prevent for bad prevention. And third, to control malaria, the best way is changing the consciousness of people. So education is the best way. I think education is the best way to change this consciousness. So I think malaria control in Africa could. I think we could control malaria in Africa in the future, but I don't think it becomes short term. So I think the education. I think education is a. So we should work from Iraq to Africa without hesitate. Thank you for listening.